Hello everyone, very good afternoon to all of you. Am I audible? Please let me know whether I'm audible or not. Thank you for attending this session, and I think everyone is present. Can I start this session? If I'm audible, please let me know. Okay. So this will be a very interesting session because this is a chapter which requires a very basic concept. First, you let me know my voice is clear to you or not. First, let me know whether my voice is clear to everyone or not. I'm just waiting for a few others people to join, and you let me know whether my voice is audible to everyone or not. Is I am audible to everyone? Yes, I think it's audible to everyone. So again, a warm welcome to everyone for attending this session, and I can guarantee you after the end of this session you will have a very robust idea of the entire chapter. Okay, so please attend the session sincerely, and we will discuss the questions one by one. Okay, so let me find how many. Yeah. All right. Okay. So the first question I'm asking everyone before starting this session, I just want to request everyone, those who are new here, subscribe this channel because this gives us motivation to arrange more live sessions which will be beneficial for the NEET exam. So subscribe this channel. I would request everyone, and I want to give a short introductions of mine. I'm Dr. Debajyoti. I had done my MBBS from one of the premium institute in India, Calcutta Medical College, and I'm right now pursuing the super specialty degree in the radiology, which of the topmost dream branch from all the medicos. And I have achieved many accolades, like I have met Dr. APJ Abdul Kalam for few projects, and right now I will start this session on human reproductions. All right, so thank you everyone. The first question is right now. So right now this is the first question you can see on the screen. So the first question is very important. Which of the following cell of testis can produce estrogen? Basically, you have an idea that estrogen is a product which is basically found mostly in the female body. But you have to also understand there is a balance. Even estrogen is present in the male body. My question is, from which particular cell in the male body, even in the testis that is already being mentioned in the question, estrogen can be synthesized? Okay, estrogen can be synthesized. Okay, let me find how many of you know this answer, and those who have joined, if you want to share this link to your friends, you can, so that we can togetherly enjoy this session. All right, so all right, so now let me find, yeah, the correct answer. People are also already answering. Let me find how many of you have answered correctly. Tina Ghosh answered correctly. Shreya Paja, Shoro Mita Malakar, Shoheri Dhara, Mihir Josh, Ohana Ash, Ritik Pathak, Shoheli, SRD Creation, Shomi Mondol, Shreya Paja. Yeah, all right. You have answered this question correctly. So let me explain in a brief and the additional information that you require for the NEET exam. So first you have to remember that whenever you were saying about the Sertoli cell, this is one of the MCQ cell. Okay, so this is one of the MCQ cell. When I'm talking about the Sertoli cell, it is one of the MCQ cell for the NEET exam. So, you know, the Sertoli cell, it has many important functions. When I'm drawing its structure, just follow me nicely. This is a structure which I'm drawing for a ST, that is seminiferous tubule. So when I'm drawing the structure of the seminiferous tubule, you know, this is long cylindrical cells which are basically like this, all right, like this and like this. These are actually longer than other cells, and I think you know these are known as Sertoli cells, which is already there in the option C. There are other cells on the base. This is called basement membrane. Okay, on the basement membrane, you know, the other cells are gonia cells, like this is the initial first layer cells. These are the bricks, first layer stone, first layer cells. You can say this is the gonia cells. And gonia cells is the least mature cell, or this is the most precursor cell, as you already know. This is also considered as germinal epithelium, because from this you are going to get the germ cells which are matured. And if you go from outside to inside, you will find other cells like this, and this, which are known as primary spermatocyte. If you go more to the center, you will find more mature cells, which will basically known as secondary spermatocyte. Now, one of the popular question is, what is secondary spermatocyte and what is spermatozoa? The difference which will help you to remember, when it is secondary spermatocyte, it doesn't have any tail. But when it is having a tail, it is definitely a spermatozoa. So when I am drawing the spermatozoa, this is something which is actually known as, when I'm drawing a tail, it is definitely spermatozoa. And one thing to find here, note here, that you can see the spermatozoa cells, they are very fond, they are very attracted to the Sertoli cells. Now the question is again, why? When I'm saying the spermatozoa, you know, they have tail, so their function is to swim. For the swimming, you know, you need energy. For the energy, you need Krebs cycles and glycolysis, that is the respirations, and for this you need glucose. So Sertoli cell stores glycogen, which is the storage form of glucose. That's why all these spermatozoa, they will prefer to embed their head inside the Sertoli cell. So this is one of the popular function of the Sertoli cell, that is the storage of glycogen. Now the next question is, if it is storing the glycogen, then what is another name of Sertoli cell? I think most of you knows. The answer is Nurse cell. It is a nurse. It is a nurse because it is providing the nutrition to the developing spermatozoa. That's why Sertoli cell is also known as Nurse cell. Now there are other few MCQs on Sertoli cells, like what is the other product that you can get from the Sertoli cell? Straight away, you have to remember, on Sertoli cell, FSH hormone works. Again, I'm repeating, on Sertoli cell, FSH hormone works. Now, FSH is the hormone which is a trophic hormone and which is being released from the pituitary gland. And you know, this is anterior pituitary that I should mention, obviously. This anterior pituitary will secrete FSH and will stimulate your Sertoli cell to produce estrogen. So you can find Sertoli cell which is only present in the female, the Sertoli cell which is only present in the male, but on presence of FSH hormone in a male body, it can also secrete estrogen. At the same time, I want to say one important fact. When your body, being a male, you are secreting estrogen, you know what happens next? This estrogen will create the femaleness. That's why obviously Sertoli cell will produce another counteracting product which is known as inhibin. I want to mention again, which is called inhibin. So inhibin is actually called anti-FSH. Inhibin is actually anti-FSH. FSH will stimulate the Sertoli cell to produce estrogen. Inhibin will inhibit the Sertoli cell to produce estrogen, and thereby in a body of a male, the balance of estrogen synthesis is regulated. Now, And to tell the next question, because though from the Sertoli cell, other few actions I should mention, that's why I'm mentioning, but I will not explain in detail here. So Sertoli cell is also source of, number one, Sertoli cell is also source of ABA, that is an androgen binding peptide. You know, around outside the Sertoli cell, there is a group of cluster of cells which is known as Leydig cells. And this Leydig cell secretes a hormone which is testosterone, which is called male androgen, or androgen simply. These androgen are secreted in a very lower or nominal quantity. That's why when it is entering inside the seminiferous tubule, this entire structure is seminiferous tubule, you know, then it needs to be concentrated and stored properly. Androgen binding peptide is actually testosterone binding peptide. This is the peptide. Okay, this peptide, androgen binding peptide. Okay, ABP I should say, rather, not ABA, sorry, androgen binding peptide. This is the peptide which is present in the center of the seminiferous tubule, and thereby, you know, it will concentrate the testosterone, and you will get the continuous supply of the testosterone inside the environment of seminiferous tubule. Because seminiferous tubule requires inside the seminiferous tubules, you know, there is a development of that is called spermatozoa, which requires testosterone. And another thing that you have to remember, this role of Sertoli cell, not only the secreting the ABP, it also helps in formations of BTP, that is the blood testis barrier. So you might be surprised, what is blood testis barrier? I think you have heard about blood placenta barrier as well. The blood placental barrier or the blood testis barrier, this is the or blood brain barrier. These are the barriers, the blood with another organ. This barrier is very important because blood contains so many offending products, many free radicals which can damage your normal body cells, many toxic substances as well. So you need the proper barrier between the blood and any vital organ, be it your brain, be it your placenta, or be it the testis. Now this barrier has to be maintained in a nice way, and different cells of different organs help in formations of this barrier. Here for the testis, it is the Sertoli cell which helps in maintaining the blood testis barrier, because Sertoli cells is bigger enough. So it will definitely help in formation of the barrier. And I want to tell you one important fact here as well, that when you are getting the blood testis barrier, Sertoli cell, it is also known as nurse cell, that you already know, and it is also known as sustentacular cells. It is also known as, I should definitely mention this one, it is also known as sustentacular cell. Sustentacular cell. So sustentacular cells or nurse cell, these are another name of Sertoli cell. So the functions of the Sertoli cells, you know, number one, androgen binding peptide, blood testis barrier, inhibin synthesis, number 3, number 4, estrogen synthesis, and number 5, it provides the nutrients to the nurse cell. That's why it is called sustentacular cells or the nurse cell. All right, hope you have enjoyed this question. The next question is coming on the screen, and Sertoli is the correct answer. We have to discuss many more questions. We have to discuss 40 questions because I have already promised you. Okay, and this will be a power pack session today. So stay tuned and enjoy each and every question. HCG, which is a very common question. Hope you, people are asking what is blood-brain barrier. Blood-brain barrier is something which helps your brain so that the harmful products of the blood cannot enter easily into the brain. In the blood-brain barrier, there is a cell, astrocyte cell, which helps in formations like in testis. It is your sustentacular cells or Sertoli cell, which is helping in formations of barrier. So the next question is, again, I can find, people are answering so intensely. Amrita answered, Tina answered, Shoromita answered, Shayani answered. So HCG corresponds to all except. Okay, this is a very popular question. I can guarantee you definitely one question will be asked in the NEET exam where the topic will be HCG. So first of all, I think you know HCG is human chorionic gonadotrophin. So again, as I always say that for biology, the knowing the terminology is very important. H for human, C for chorionic. Chorion, now what is the chorion? Chorion is a membrane, which is a membrane of actually fetus. It is also known as fetal membrane. So if I draw the structure of the uterus, and I am drawing the uterus for a pregnant lady, so definitely I have to draw in the endometrium. Again, I am saying the fetus will be present in the endometrium. If the fetus is present in the myometrium, it is a pathological fetus. So please do remember, though I know during the delivery of the baby, your myometrium will help in causing the contractions, but you have to remember for the implantations or giving the bed to the baby, your endometrium only helps, not myometrium. So again, this is the endometrium I'm drawing, and in the endometrium you can see this is the fetus or embryo, you can say, because fetus and embryo there is a difference of there is a difference obviously. Up to 2 months the product is known as embryo. After the 2 month or 9 weeks, you can say this is known as fetus. So if I see the membrane of the fetus, this is called chorion. All right, now definitely this is the hormone whose source is chorion. Now again, if I go in detail and I zoom this chorion, you can see this is the chorion. This is the membrane. This is a membrane, fetal membrane, within which you can see the fetus is there. Okay, this is something I have drawn in zoom. Now I just want to tell you, it's a very important question that when I'm drawing this one, this is something known as syncytotrophoblast. Syncytotrophoblast. Okay. Now I want to tell you again, if anyone is asking what is the source of HCG, yeah, fetal membrane and the chorion is definitely an answer. It's a good and correct answer. But if you tell it specifically, you have to say syncytotrophoblast is the more accurate answer. Okay. So syncytotrophoblast is more accurate answer for NEET. Okay, you have to remember, because in exam this question will be asked for you. All right. Now syncytotrophoblast is a source of HCG, and you know gonadotrophin. This is also called gonadotrophin. What is the significance of G? G is the gonadotrophin. Now we have to know what is the gonad. For female, you know the gonad is primary gonad, secondary gonad. Obviously we are talking about the primary gonad, that is the ovary. So HCG will definitely stimulate the ovary of the lady. Now the question is how. So first options, let us read the options one by one. Releases after implantation, absolutely correct answer. HCG is a hormone which is also being tested whether the lady is pregnant or not, to identify this fact. You know, there is a popular advertise in the television which is the Prega News. This Prega News is actually a kit which is available in the market, in the pharmacy shop. And what we do actually, we request the female, the lady, to collect urine in that kit. And if you collect the drop of the urine in that kit, and if the urine contains HCG, because HCG is a hormone which is also water soluble, this concept you have to remember, because other hormone like estrogen and progesterone, they are not water soluble, but HCG is water soluble hormone. So it will be easily available in the blood and it will be easily available in the urine. So if you ask the lady to keep urine in that kit, that HCG wala kit, what do you find? That will interact. Okay, that will react. Okay, because here, you know, there is a sensor of HCG is there in the kit, and you know you have put a drop of urine, so obviously that will react and you will find the red line. This red line signifies that yes, HCG is present in the urine, and that's why it is interacting. So this is very, very important. So it obviously it releases after the implantations. And you know what is the day of implantation? Who can say what is the day of implantations? Day of implantation is 5 to 7. Okay, in few cases it is implanted in the day 5 after the day of zygote formation, and in few cases it is implanted in the endometrium at 7-10. So absolutely correct answer. After the implantation, from the syncytotrophoblast, there is a secretions of HCG. Now next question, it maintains corpus luteum. Is this true statement or false? It is also true statement, because since HCG is a hormone which will act on the ovary, as I have already explained. But when it will act the ovary, when in the ovary you are already getting like this is called corpus luteum. In the ovary we get corpus luteum, okay, because when the from the ovary there is a release of ovum. After the release of the ovum, there will be empty space. Initially there will be blood accumulations in that space, and finally there will be accumulations of the yellow colored substance in the ovary. And when that yellow colored substance is deposited in the ovary, this is called corpus luteum. Now this corpus luteum is a structure in the ovary which is not maintained for long if you are not applying HCG on it. Again, I am repeating, corpus luteum is a structure in an ovary. It will not be maintained long if you are not applying HCG. But if you apply HCG on the corpus luteum, I mean if the lady is pregnant and the HCG level is quite high in the body, then this corpus luteum will persist for long. So the option B is again correct. Option C is saying syncytotrophoblast is the source. I have already explained the direct answer of it. Even in absence of HCG, pregnancy is maintained. This is absolutely wrong, because HCG will ultimately help in formations of the corpus luteum, and the corpus luteum will be the source of three important things in the lady. Number one, the progesterone, the first answer of you. Then you have to say corpus luteum is also source of estrogen, and corpus luteum is also source of relaxin. But this will be your order of answering. If in your question you get the progesterone only, you have to mark it first. If you get multiple options correct, like more than 2 options correct, if your question is saying, you have to also mark estrogen is also secreted from the corpus luteum, and also the relaxin. Okay, so please mark it. It's a very, very important informations that progesterone, estrogen and relaxin is synthesized or secreted from the corpus luteum of the ovary. Okay, I hope you have enjoyed these questions. So we are going to the next question. So the incorrect answer is even in absence of HCG, pregnancy is maintained. Next question. Which of the following is mismatched? Which of the following is mismatched? Okay, answer this question. It's an easy question, and this is the question based on the concept homologous organ. This question is based on the concept homologous organ. Homologous organ. Okay, this is a very easy question, and let me find, and I would request everyone share this link. This is a afternoon class. I think you people are enjoying, and if you're really enjoying, share this class, subscribe this channel. It gives us motivations to conduct new sessions, further sessions live in YouTube. So which of the following is mismatched? Which of the following is mismatched? I mean, all pair which I have mentioned here, this is actually the example of homologous organ of a male and female. But if you see one example, one option is not matching that. Let me find how many of you have answered this question. Okay, so people are already answering. Okay, Srikanto Odhikari answered, Shoheli Dhara answered, Shoromita Malakar answered, and okay. So now let us see the correct answer. The correct answer, absolutely correct answer, C is the correct answer. So people have answered it correctly. Let me explain it one by one. What you have to remember, for the female, the labia majora. Okay, for the female, let me draw the structure which will help you most. So if I draw the structure of the female external genitalia, this is the buttock of the female, and this is the thigh of the female. This is the another thigh of the female. So if I draw the external genitalia of the female, this is called outside the leaf-like structure is called labia majora. The another leaf-like structure which is called labia majora. Within that leaf-like structure, there is a small leaf-like structure which is called labia minora. In this labia minora, you will get opening of urinary opening. You will get the vaginal opening for the coitus, and behind it you will have the anal opening, which is not a part of this genital system, obviously. Now I want to tell you this labia majora is homologous that of the male scrotum, that of the male scrotum, number 1. So this is the correct option. If you see the clitoris is the structure which is present at the top of the urinary opening of the female, that is the urethra, which is called clitoris, and this clitoris is similar that of the structure of the penis. All right. Now the next question, Bartholin glands and Skinner's gland. What is Bartholin gland? Bartholin gland is a gland which is present. I am just drawing these things in a larger way. If this is the vaginal opening, around the vaginal opening you will have some glands in female. This is called Bartholin glands. Okay. In the same way, around the urethra you have some glands which are called Skinner's gland. So there is another popular name. Skinner's gland are present around the urethra, which is a small opening. That's why Skinner's gland is also known as smaller vestibular gland or lesser vestibular gland. And the same way, the Bartholin glands is present on a bigger opening, around the bigger opening. That's why it is called greater vestibular gland. That's why it is called greater vestibular gland. Now the question is, this is the name for the female, but which is homologous with the male definitely. So if you draw the male structure, in case of male, this is the penis. If I draw, this is the urethra which is being passed inside the penis. You know, at the bulb, at the base of the penis or bulb of the penis, there is something gland which is called Cowper's gland. Okay, this is called Cowper's gland or bulbourethral gland. This is known as greater vestibular gland. So Cowper's gland is Bartholin gland. This is absolutely correct answer. But option C, if you see, Bartholin gland is Skinner's gland, absolutely wrong. Because Skinner's gland is actually, it is homologous to, if I say the Skinner's gland or lesser vestibular gland, which is around the urethra. In case of male also, around the urethra there is a gland which is a pear-shaped gland. Okay, and you already have heard about this disease. In case of elder age, the male is having the larger prostate gland. This is called prostatomegaly. Difficulty in the micturations, that is the passing urine, and this is called prostate. So lesser vestibular gland is actually homologous with prostate of male, not Bartholin glands. Okay, because Bartholin and Skinner actually same, both are of female. You can also, if you have idea also, you can also exclude in this way, because all the questions are actually depicting the homologous organ, but Bartholin is example of the female version and Skinner is also example of the female version, I mean the female gland, so they cannot be homologous. So you can answer in this way as well, or you can see that Skinner should be matched with prostate, or Bartholin should be matched with Cowper's gland. So definitely option C is neither way it is matching. Obviously we will answer the option C. So let me find, this was a very tricky questions, but many people have answered it correctly. I'm proud of you. Mouli Haldar answered it correctly. Toromita deleted. Okay, all right. Mihir Jash, show me it was wrong. It's not B. Clitoris, penis is same. Okay, the clitoris is actually the smaller versions of the penis in female, so it's correct. Okay, now the next question. The next question on the screen, you can see all the organs are divided to the cortex and medulla except. If you have the proper idea of the biology, you know all the organs are divided into cortex and medulla. If you see for the ovary as well, for the kidney, for the spleen, for the testes, so which of the organ does not have the concept of cortex and spleen? And each of the organ, the options which are being given here, you know, for NCERT, each of the option is clearly mentioned. Okay, all right, so each of the options are clearly mentioned in NCERT that this organ contains cortex and medulla. So now you tell me what is the correct answer. Okay, let me find people are answering. Pritam Shamanto answered C. Shreya Paja answered C. And Shahil Dhara answered C. Ankita Ghoshal answered C. Everyone is bowled out. Everyone is bowled out because, okay, now definitely answer will change. Everyone is bowled out. Everyone is bowled out here. So I just want to tell you that ovary contain, if this is the ovary and it contains outer cortex and inside medulla. Okay, kidney, from since your childhood, you know that is called outer is called the cortex and inside is medulla. Now you are confused between the testis and the spleen. If I want to say the spleen, in the spleen, in case of spleen also, there is called this is the splenic cortex, okay, and this is the splenic medulla. So the correct answer will be testis. Correct answer will be testis. In the testis, there is no concept of cortex testis and medulla testis. There is no concept of cortex testis and medulla testis. Testis is a structure which is compartmentalized in this way. Okay, each of the compartment contains 2 to 3 seminiferous tubules that you already know, and you already know the layers of testis. I think you already know tunica albuginea. Outer layer is tunica vaginalis, then tunica albuginea, then tunica vascularis. I'm not going in detail right now. I just want to say you testis does not have any concept of cortex and medulla. And hope you know the plural versions of the testis. The plural version of the testis is TES, okay, not TIS. That is a plural of testes. I mean both testes. Okay. Next question on the screen. Which of the following organ is present in between bladder and rectum? This in main. This is a very, very important question. Let me draw. This is, I guess, this is the abdomen. This is the abdomen. Okay. This is the abdomen. And this is the back. This is the hip. And now you tell me what is the organ. For both male and female, you have the organ in front, which is actually the bladder. And behind the bladder, what organ you have? Okay, definitely rectum. But in between the bladder and the rectum, there is an organ for male and there is an organ for female. So now let me find how many people are answering this question nicely. Okay, so what is the organ which is being present? Okay, now let me find. No one has answered till now. No one has answered till now. So I'm waiting for your answer. I am waiting for your answer. Okay, people are answering. Okay, people are answering C, prostate. Okay. Okay, all right, keep answering. Someone is answering Aisha is answering C. Everyone is answering. Okay, someone is answering urethra, someone is answering prostate. All right, someone is answering. Okay, let me find. Okay, this question will be so interesting. Okay, I know. So someone is answering A. Okay, seminal vesicle. Dipti, Pal and Onkita, they answered. Seminal vesicle is the organ in male which is present in between the bladder and the rectum. Okay, Rudrani Thakur answered it A. Okay, all right. Now the trend has changed. It is right now A. Now Shojan answered A again. So I think this is the time I should answer. First, I want to tell you if it is a female. If it is a female, then definitely the organ which will be in between the bladder and the rectum, I am drawing. This is the uterus. And then at the bottom of the uterus you have cervix, and at the bottom of that you have the vagina. Okay, you already know. And the same way you have to think about, so uterus is sandwiched between the bladder and the rectum for the female. But if I talk about for the male, what would be the answer? That's why I'm just giving you a hint. For the male, that organ is known as or considered as uterus masculinus. What is the meaning of uterus masculinus? That is the male uterus. Male is not having any uterus at all, definitely, but that particular organ is considered as the male uterus, and the same will be present in between the bladder and the rectum. So let me erase this one. And let me draw the male versions of it. So when I'm drawing the same for the male, and you have to know there are two glands, not one, this one and that one. Okay, which is present and which will be separately opening into the structure. So I think now you can easily guess. You can make a very easy guess right now. This is the SV, seminal vesicles. But contrary to the uterus, it's not 2 in number. Contrary to the uterus, it's not 1 in number. Seminal vesicles are 2 in number. And each of the seminal vesicles will open separately. Again, I'm repeating. Each of the seminal vesicles will open separately. Okay, each of the seminal vesicles will open separately. All right, everyone. Okay, now Do you know what is ejaculatory duct? Do you know what is no? Prostate is not the correct answer, beta. Prostate is present here. Let me draw. Okay, people are telling sir why the prostate is present. The prostate is present below the bladder. The prostate is present below the bladder. See, this is your prostate. Prostate is present below the bladder. My question was, which of the organ is present in between bladder and rectum? The answer will be seminal vesicle. All right. It is also known as male uterus. Next question. Next question is again very important. Spermiation occurs. That's a concept. Spermiation is the concept, and you should know this concept, the spermiation. Okay, that's a very important concept. Spermiation. Spermiation is occurring in which organ? You already know. If I draw the structure of the male reproductive system, this is the testis, you already know. This is the epididymis, you already know. This is something called, vas deferens. This vas deferens will go like this, and it will again join with the seminal vesicles. Okay, it will join together. They will form something which is called ejaculatory duct, and that ejaculatory duct will open into the part of the urethra. Okay, you already know. There is another left-sided system as well. I have only drawn the right-sided system. So, and you already know that seminal vesicle is present just behind the bladder. So yes, this is the diagram it should be. So the question, spermiation occurs it. Well, so people are answering yes. Most of the people have answered correctly, but I know that people will be confused in between the option testis and epididymis. I was very sure that people will be confused between the options testis and epididymis. Okay, so now just I want to tell you what is the concept of spermiation. If you want to know the concept of the spermiation, you have to cut the testis and you have to draw it again. When I'm drawing the testis, these are the seminiferous tubules. 1, 2, 3 seminiferous tubules I have drawn. I have also drawn the detailed diagram of the seminiferous tubules with Sertoli cells and other Gonia cells that you already know. But the event I am right now discussing is spermiation, which is actually, can you remember just before a few minutes, I explained the head of the spermatozoa is embedded in the cytoplasm of the Sertoli cell. Yes, you know already. What was the purpose? To get matured. But if you find that this head should be detached, the detachment of the head from the Sertoli cell, again I'm repeating, the detachment of the head of spermatozoa from the Sertoli cells is known as spermiation. It is known as spermiation. So the correct answer, where the spermiations actually occur, the correct answer will be testis. The correct answer will be testis. The detachment of the question is where it occurs. It occurs in testis. Testis is the correct answer. But if I tell you, because so many people have read many questions, they have solved many questions where the answer is epididymis. So what are those questions I am telling? If anyone is saying, after this detachment, that is the spermiation, what this spermatozoa will do? They will simply go into the room of epididymis to get settled down, to take rest, to take not nutritions to take a little bit rest. So they will take rest in the epididymis, short-term rest, not a long-term rest. So that's why another questions are there in NCERT, which is the temporary, where the temporary storage of the sperm occurs. The answer will be epididymis. In the epididymis, there will be temporary store of the sperm. Definitely the next question comes to your mind, where is the permanent store of the sperm? Okay, the permanent store, for the permanent store, this spermatozoa will go and take rest for the permanently into the seminal vesicle. So seminal vesicle for the permanent rest and epididymis for the temporary rest. Next question, when from the seminal vesicles the sperm will come in the ejaculatory duct and ultimately pass through the urethra, to the penis and to the outside? The answer will be, it can happen during the ejaculations during the mating or ejaculations during the other process. So this is very important questions that is the storage of sperm temporarily in the epididymis and permanently in the seminal vesicles. But the spermiation is a different concept, detachment of the head of spermatozoa from the Sertoli cell. That's why answer is testis. Next question, which is a very popular question. You should have the proper structural idea of the female reproductive organs as per NCERT, because you know in NEET exam there are many informations in NCERT. Don't neglect NCERT. My one and only informations, those who have attached, who have joined these sessions for the first time, I would request NCERT, don't neglect NCERT. NCERT has a lot of informations. You might be thinking these are not useful, but trust me, NCERT has such informations which are very high level and which can be useful in your future higher studies as well. So don't neglect NCERT. Try to read NCERT as many as possible. And I will definitely help you to pick up the words and the lines from NCERT, and how the question will be framed from those lines I'll also show you. Okay, so the next question, the false regarding the fallopian tube. If you want to know what is the false regarding the fallopian tube, okay, people are answering. Let me find. Okay, I don't have much more time. So yeah, everyone is answering correctly. Shoheli Amrita, Rudragni Thakur, and Ritik Pathak, and Anindo Banerjee, Shubham Shaha, Dipti Pal, Shani Hajra, Ankita, and Shudip. So everyone has answered it correctly. Okay, absolutely correct answer. I'm happy and proud of you. So yeah, so if I talk about the fallopian tube, it's 10 centimeter that you have to remember. Absolutely correct answer. Infundibulum is the proximal to the ovary. So this is something bit tricky. You have to remember the first portion, which is actually funnel like. This is called infundibulum, that you already know. The next portion is actually dilated portions. Okay, I should draw it like this, the dilated, yeah. And then in funnel like, yes, this is should be the actual structure. So this is the funnel like structure, infundibulum. This is the dilated structure, which is called ampulla. Next is called the isthmus, and next part will directly enter in the wall of uterus. That's why it's called intramuscular part or intramural. Mural is the wall. The meaning of mural is wall. Anyways, so the infundibulum is proximal to the ovary. If I see the ovary, you know what is called in proximal. What is called proximal? Any structure which is close to the midline is called proximal. Any structure which is distant from the midline is called distal. So obviously ovary is distal, infundibulum is proximal, so it is correct answer. Widest part is ampulla. You can see widest part is the ampulla. That's why the meeting of the male gamete and the female gamete, that is called the formations of the zygote, which occurs at the junction of the ampulla isthmus junction, which is the best answer. But if you don't get the options, ampulla is also correct answer, where you will get you will have the meeting between the male gamete and the female gamete. It is also correct answer. And isthmus is the site of syngamy. It is wrong. If you are saying ampulla isthmus junction, it is best answer for the site of syngamy. Syngamy is the fusions of the male gamete and the female gamete. Syn is the fusions, gamy is the marriage. And if you don't get the AI, ampulla isthmus junction, you can go with also the options ampulla, but never ever you can say only isthmus, because isthmus rather it's the narrowed portions. If you in this narrowed portions of the zygote formation, syngamy is not possible. So correct answer is D. Next question, question number 8. Jonah pellucida performs all except. We have to change our brain. We have to think about the ovum structure. I think most of you know the structure of the ovum. Okay, I am drawing the ovum in between. You should answer the question in the YouTube chat box. I'm waiting for you. So the first is vitelline membrane. You know, the next one is something, you know, something called Jonah pellucida. So let me draw the Jonah pellucida. Okay, I will also mention the other relevant MCQ from the Jonah pellucida as well, because it's a very typical question for the NEET exam, and you have to know its concept as well. So this is the Jonah pellucida. All right. The first one, this one is called the vitelline membrane, that is a VM. Okay, the outer to it is called Jonah pellucida, that is a ZP. Outer to that, you have some cells which are present in a scattered way. Okay, the third layer is actually not a layer, rather you can say the third layer is made up of cells which are being scattered outside, and these are called corona radiata cells. These are called corona radiata cells. So this is called CR. And as you know, in case of corona radiata cells, in between the corona radiata cells, you have some matrix, and I think most of you know the matrix is made up of a very popular biochemical substance, and that substance is called hyaluronic acid. So this hyaluronic acid is actually present in the layer of corona radiata in between the corona radiata cells. Now the question is asking you about the Jonah pellucida. What is the functions of the Jonah pellucida? Okay, and definitely I have to draw the nucleus at the center, which is the queen. So the first question, cortical reaction, absolutely correct answer. You have to know what is the cortical reactions. If you think about a sperm which is approaching to the, if you think about a sperm which is approaching towards the ovum, once the sperm is touching the ovum, what happens, like if it is touching the Zona pellucida layer, what would happen, that there is a granule which is made up of heteropolysaccharide, I mean carbohydrate granules. They will be deposited like a wall or barrier around the entire ovum. So what's the reason? The reason is because you have already permitted one sperm, so you cannot permit the next sperm to enter in the room. That's why it prevents the polyspermy. So this is absolutely wrong, that it has no role in polyspermy. Rather, Jonah pellucida performs all, and it has also role in preventing the polyspermy. Okay, it has no role in polyspermy. This is wrong. There is a role in polyspermy. Okay, there is a role in polyspermy. It is a part of secondary egg membrane. Okay, now I have to tell you what is primary egg membrane, what is secondary egg membrane, what is tertiary egg membrane. Primary egg membrane is a vitelline membrane. Secondary egg membrane is the Jonah pellucida, and corona radiata is called tertiary egg membrane. If your egg contains a shell of calcium, that is also tertiary membrane. And if an egg contains calcium cell, that is also called cladoic egg. That's a popular NEET MCQ. What is cladoic egg? CLEDOIC. Cladoic egg means it contains a tertiary membrane around the egg, which is actually made up of calcium. Cladoic means calcium cover. Okay, so this is the secondary membrane. That's also correct. Option number B, prevents the implantations in the fallopian tube. Absolutely correct answer. Prevents the implantations in the fallopian tube. You might be surprised that, sir, you have mentioned in the ampulla. This is the ampulla. If I draw, this is the infundibulum that I want to draw. Sir, you have mentioned that there is a formations of the syngamy and the zygote in the ampulla, but you don't want it get implanted in the wall or in the endometrium of the fallopian, because you don't have endometrium in the fallopian tube. That's why you don't want the zygote to be implanted in the ampulla. So what do you want? You want this zygote should move to the uterine bed to get implanted. Again, I am repeating. Inside the fallopian tube, you should not implant your product. If you're really doing this, the lady will die, even can die, and the lady will have an emergency that is called ectopic pregnancy. What is ectopic? Ecto means not a good place, or I mean not in proper place. That's why it's called ectopic. So ectopic pregnancy means not in a proper place, because the proper place of implantations is the endometrium. If this is the uterus, this is the endometrium, this is the proper place of implantations, not the fallopian tube. Fallopian tube is not the place of implantations. Okay, so prevents the, and now if anyone is asking you how the ovum will get to know that I should not get implanted in the fallopian tube, because whenever till that time the ovum is present in the fallopian tube, it will maintain its Jonah pellucida layer. That's why this Jonah pellucida will prevent the implantations in the fallopian tube. Okay, but whenever this product will go into the uterine lumen, then this Jonah pellucida layer will go away and you can get implantations process in the uterine lumen. Are you getting everyone? Are you getting? Yes or no? Please show a big thumbs up. I'll be happy to show you thumbs up and smiling faces, because this is a very conceptual area that I have discussed. If you have missed any part of these discussions, you can also watch this video. It will remain as public video in the YouTube forever. So don't worry about that. But if you are really enjoying these discussions, then show thumbs up. Then I will be happy and I will be more confident in discussing this session. Okay, thank you so much. Arnob, Shayani, Shoheli, Onindo, me, Josh, Mowli Haldar, Deepika Das, Tina Ghosh. Okay, all right, Ritik. Okay, all right. So we are moving to the next question. The next question is surest proof of virginity. This is a question in the NEET exam. Definitely 3 to 4 questions will be from human reproduction and reproductive health, and you cannot afford making any mistake for those questions. One of the popular topic of questions from human reproductions and reproductive health is the sign of virginity or hymen. That's why you should have the correct idea from NCERT that what is the surest proof of virginity. Option is pinhole cervix. Pinhole cervix, it's definitely present in those girls where for those cervix which is not helping or which hasn't helped any time in the lifetime for passing the baby. Once the baby is passed to the cervix will not be pinhole, it will be a bit dilated. So but it is not a proof of virginity. Cervix sign is not proving the virginity present or not, so it's a wrong answer. Intact hymen. If I say intact hymen, the hymen is a membrane like structure. Okay, I know most of the people will answer this question. Okay, let me find. Still people are answering D. Okay, people are answering D. That's a great session. So if you know, like this is the membrane. I'm saying you, this is hymen membrane. Sometimes it may happen even after the sexual intercourse, the hymen is intact, because I think you know the concept. This is the vagina if I draw, and this is the hymen I am drawing. If the hymen is very elastic, it may pass like this. Even the penis is present in this way, and the hymen will be so elastic so it can resist the penetration force. All right, so intact hymen is not surest proof of virginity. Imperforate hymen, this is a medical condition. It's not expected. What is imperforate hymen? Imperforate hymen is not torn hymen. Imperforate hymen means every girl, be it virgin or non-virgin, they should have a small opening. They should have a small opening in the hymen membrane. Why? Because there is a process which is called menstruation, in which the blood passes from the uterus, which should pass from the vagina to the outside. But if it is completely blocked, even the menstrual blood cannot pass in a virgin girl. That's why the blood will be continuously accumulated, and it is a very unwelcome situations for the girl. So obviously imperforate hymen we won't expect. And yeah, you can say imperforate hymen if is there, you can say this is a surest proof of virginity, but we cannot expect. So the best answer is actually none. None is the best answer, because you won't find imperfect hymen in everyone. Imperfect hymen you will find hardly in a small percentage of population, and it's a medical condition, so it's not a proof of virginity. Okay, so definitely you have to answer this question as none. You have to answer this question as none. Absolutely correct answer. Let me find how many of you have answered this. Okay, so Ankita De, Arnav Hajra, Ritik, Shomi Mondol. Okay, so all right. So the next question before you, the which is extra testicular, which one is extra testicular? So that's why you have to know the internal structure of the testis. Let me draw the testis structure in detail. You will have a short revision of the testis as well through this question. So by this time, let me find how many of you are answering correctly. Okay, so if I draw the structure of the testis, as I have mentioned, the outermost layer is called tunica vaginalis. The next layer, which is made up of the collagen protein, collagen fiber, this is called tunica albuginea. And you know, tunica albuginea will give some membrane like structure, which will pass inside, and you know, it will make the testis in compartments, and that's why these are called compartments of the testis. How many compartments you can expect in testis? Almost 200 compartments are there in the testis, and you know, in the each compartment, there is something is called seminiferous tubule. Okay, there is in the each compartment you have something called seminiferous tubule. Let me draw how many seminiferous tubules you are having in each compartment. Okay, so 1 2 3, so these are the seminiferous tubules in each compartment. So just remember 2 to 3 seminiferous tubules are there. So in each compartment you have, just hold on, there is, I guess, some technical glitches are there. Okay, yeah, all right. Okay, just hold on. Okay, just hold on, and for the time being, yeah, okay, just hold on for the time being. All right. Okay, just hold on, and things will be settled down. Just hold on, just hold on. Okay, all right. So is it visible to everyone? Is this visible to everyone? Is it visible to everyone? Yes or no? I think yes. So, all right. So, what do you have to know? We were in the discussion that which of the following is extra testicular. Which of the following was extra testicular? So for this, listen, due to this technical glitches, actually I will only explain, and so I would request you to cope up with this scenario. I will explain definitely. So which of the following is extra testicular? So extra testicular, it means like, you know, if you see the structure of the testes, in the structure of the testes, you have a long seminiferous tubule inside. You have retitestis, that is a reticulum testis inside as well. You have vasa efferentia in the testis structure as well. But all the vasa efferentia, they will come out of the testis. They will come out of the testis and they will join to form something which is called epididymis. So correct answer will be present, not in the testis. Epididymis is present outside the testis. Epididymis is present outside the testis. Clear, everyone? Clear, everyone? Yes or no? Option D is the correct answer. Have you understood, yes or no? Okay. So the next question, question number 11. Next question before your screen, question number 11. Okay, question, you try to answer this question number 11. You have seen this question as well. Okay, by this time I am trying to fix the scenario. All right. So you know that question as well. Urethra passes through all except, that was the question. You keep answering the question. You keep answering this question. I would request you keep answering this question. Yeah. All right. So people have answered this question. Let me find how many of you have answered it correctly. Okay. Okay. All right. All right. Yes. So let me find how many of you have answered correctly. Urethra passes through all. This is the answer. I want this answer against this question number 11. Which of the following urethra passes through all except? Urethra, if you just imagine the structure of the urethra, it passes through prostate, it passes through penis, or it passes through vestibule, it passes through seminal vesicle. With three structures, urethra will definitely pass, but with through one structure, it will not pass. The correct answer is seminal vesicle. Absolutely. If you have the idea of the male reproductive system, obviously seminal vesicle is the answer, because seminal vesicle, rather, it will join with urethra. Through seminal vesicle, urethra will not pass. Rather, seminal vesicles will join together, will fuse with vas deferens, will form ejaculative duct, and they will join separately with the urethra. Next question. Oxytocin receptor present in. Oxytocin receptor present in. Oxytocin receptor present in cervix, endometrium, myometrium, or parametrium. You know already oxytocin is a hormone which helps in creating the contractions in the uterus. Now you have to identify which layers of uterus will help in contractions, and people have answered it correctly. Yes, Shoromita Malakar, you are correct. Yes, Mowli, you are correct. Yes, Amrita, you are correct. Ankita, you are correct. Shreya Paja, you are correct. Anirban Dhara, you are correct. Everyone right now answered correctly. Yes, it is obviously myometrium because it is muscle. The muscle will act more strongly in presence of oxytocin. Absolutely correct answer. Okay. Next question. Sertoli cell does all except. Sertoli cell does all except. ABP release, forms blood testis barrier, releases testosterone, releases inhibin. I have already explained this question in the very first question, so I want everyone to answer this nicely. I want everyone to answer this nicely. Okay, so I think this is a view obstruction. So what I can here, just hold on. So I think this is a view obstructions you are having right now. Okay, all right. All right. Okay. All right. So you tell me Sertoli cell does all. So what is the correct answer, beta? What is the correct answer? What is the correct answer? Let me find. Okay. So yes, it is releases testosterone. Absolutely correct answer, because testosterone is something which is supposed to be released by the Leydig cell, which is present outside the Sertoli cell. I have already drawn. If you cut the testes, you will find many Sertoli cells. You will find many seminiferous tubules. Can you imagine that tube-like structure which is called seminiferous tube? If you cut them, you will get a circle-like structure. If you cut a cylinder, you will get a circle. That's why if you cut a seminiferous tubule, in the cross-sectional view, you will get circular seminiferous tubules, and in between those circular seminiferous tubules, you will get definitely something which is called Leydig cells, or interstitial cells of Leydig, which releases testosterone, is the correct answer. Question number 14. All of the following are actually true except. All of the following are actually true except. Okay. This one. All of the following are actually true except. Tell me the correct answer. All of the following are actually true except. Okay. So can you say the question? All of the following are actually true except. So this is LH surge, which is on the 13th day. You already know this. All right. So LH surge is 13th day. This is correct answer. Okay. Ovulations on the day of 14. Is it correct, beta? Yes or no? Yes, absolutely correct answer. If I say corpus luteum degenerate before 18th day, so yes, it is also correct. Corpus luteum degenerate before 18th day, because corpus luteum will wait for someone. Can you tell me corpus luteum will wait for whom? I have mentioned in the very first class. Who can tell me? If corpus luteum will be formed on the 25th day. Okay, corpus luteum will form on the 25th day, and it will wait for someone. Can you tell me corpus luteum will wait for whom? And if that particular chemical is present in the blood, corpus luteum will persist. If not present, corpus luteum will degenerate at 28 days. Okay. Yes, that is the HCG. Absolutely correct answer. People are answering it nicely. Shoheli Dhara, Ankita De, Amrita Dash, and Shreya Paja, Shoromita, Shoheli Dhara, Ankita, Deepika, and Mihir Josh, and Ankita Ghoshal. Yes, absolutely correct answer. HCG if present, then it will even persist more than 28 week. So can you tell me, if HCG is present in blood high amount, do you think the next cycle of menstruation occurs? The answer is no, because this corpus luteum will persist, which will continuously secrete estrogen and progesterone, If it is continuously secrete estrogen and progesterone, you know what would happen? This estrogen and progesterone will be forming the endometrium more. But what happens in the bleeding phase? Estrogen progesterone is rather declines. It is less in the blood. That's why there will be shedding of the endometrium. Okay. So here you have to understand that corpus luteum degenerates before 28 days. It's a correct statement. Progesterone has dual peak in the diagram of curve of hormone. This is the wrong. Yeah, absolutely. This is the only 2 people have answered it correctly. Yes, absolutely correct answer. This is wrong statement. Why this is wrong? If you have seen the diagram of the hormonal peak, if this is the, this is right now I'm drawing the curve. If you have seen the progesterone will be high only, I guess this is the day 14. The progesterone will be high once you form the corpus luteum, then in the 25th day, and after the 28th day the progesterone will go down. Okay, so here I am drawing like 25th day, and this is like the 28th day. I'm drawing the last one is the 28. Okay, the last one is the 28. Now I want to tell you, if I am drawing the estrogen will be higher in 2 times. Estrogen will be higher in 2 times. Okay, so estrogen will be higher in 2 times. I mean, here I am drawing a peak of estrogen like in the 12th day, and you have another peak after the formations of the corpus luteum, that is on the day 25. So estrogen has dual peak, not the progesterone. So correct answer, only one hormone in the menstrual cycle which is having 2 peak. The answer will be estrogen, not the progesterone. Okay, clear everyone? Yes or no? Clear everyone? Yes or no? Okay, Arnav Hajra, Ankita Ghoshal, only 2 people have answered it correctly. Okay, so we can move to the next question. Question number 15. GnRH stimulates to release. So first you have to understand what is GnRH. What is GnRH? GnRH, that is Gn for gonadotropin. So what is gonadotropin? Beta, you already know gonadotropin is the FSH LH. So obviously it is not GnRH, because LH and FSH, they itself are known as gonadotropin. But the question, let me read the question again. The question is saying which stimulates. Okay, the question is saying which stimulates to release. Which stimulates, GnRH stimulates to release. Yes, the question is something different. GnRH is the hormone which is released from the hypothalamus, and this is the pituitary. If I am drawing, what would happen? This hypothalamus will secrete a hormone which will stimulate the pituitary, and this hormone which is being released from the hypothalamus, this is known as GnRH. So this is GnRH which is being released from the hypothalamus, and from the pituitary you will get FSH and LH. From the pituitary you will get FSH and LH. So obviously GnRH from the hypothalamus stimulates the gonadotropin. This is called gonadotropin releasing hormone. So definitely it will release the gonadotropin. Now what is the gonadotropin? That is FSH and LH. Why these are called gonadotropin? Because they will stimulate the gonad, and the gonad is nothing but the ovary. All right, so the correct answer is both. Okay, next question. Signal of parturition, which is a very popular question. Signal of parturition develops from. Signal of parturition develops from. It's a very popular question. Signal of parturition develops from. Okay, suppose this is the uterus. This is the uterus I'm drawing. This is the uterus. Okay, in this uterus, yeah, this is the uterus I'm drawing right now. This is the fallopian tube on the either side. This is the fallopian tube. Okay, this is the fallopian tube I'm drawing right now. And if this is the fallopian tube and this is the uterus, this is the baby I'm drawing. Okay, so this is the baby. Okay, connected to the placenta, you already know. So the question is signal of parturition. Signal of parturition develops from. Signal of parturition develops from. So signal of parturition develops from the fully developed fetus. Fully developed fetus. That's the correct answer. This is a popular age-old question. It's a very common question, and I think most of the students have answered this correctly. Okay. Option A, fully developed fetus. Absolutely. So Mihir Josh, Amrita Das, Shohali Dhara, Mouli Dhara, Orno Bhajra, Shourumita, Onkita De, Jhunu Das, and yeah, absolutely, Ombika and Muhammad Akwib. You have also answered correctly. So the both placenta and the fetus. Yes, placenta is not in the options. I just want to mention. Yes, Shubhodip is also correct. Sorry, Mihit just is also correct that even the matured placenta and matured fetus will give signal. How they will give signal? They will give signal to the brain of the mother, and the mother will release oxytocin from the posterior hypothalamus. And you know what happens with oxytocin? The uterus start contracting. The uterus start contracting. All right, we're moving to the next question. The next question on the screen: fetal activity found at which week? Fetal activity found at which week? Again, I'm answering fetal cardiac activity found at which week? Who can tell me this correctly? Fetal cardiac activity found at which week? This is a question where I will mention many MCQs and many answers. So be very confident while you are answering these questions. Okay, Shrikant Todikari answered it A, cardiac activity. Okay, I know most of the people will answer that, but let me find. Okay, everyone is saying 1, 4, 4, 4. Okay, Ochira Banerjee is saying A. Shorumita is saying A. Mouli Halda is saying 4. Okay, 4 means, okay, 4 week. Okay, all right. So Tina Ghosh is saying A. Ornov is saying A, 4. Okay. So, all right, listen. The question is something different. The question is asking if you have seen your NCERT has mentioned the formations of the heart. Okay. So the formation of the heart, if I say, listen, there are a few important weeks, because can you tell me how many weeks are gestational phase? Gestational phase is a time period from the day of zygote formations, that is the day of conception, from the day of delivery. So from the day of conception, I mean the day when the lady is conceiving, up to the day of delivery, which is the 40th week on an average. This is called gestational phase. And it is divided into 3 trimester, like trimester 1, trimester 2, and remaining is the trimester 3. Trimester 1 popularly known almost to 12th week. Trimester 2 is almost like 25th week, and remaining is the trimester 3. Though as per gynecologists there are big variations, I'm not mentioning those complicated informations right now. So if I mention right now, you have to know about what are the important weeks in the pregnancy phase. First, you have to understand the week number 3. Week number 3 is the week in which you will get to one important organ, which is the brain. You will form brain of the baby at the week number 3, and that's why it's called the first organ which is formed in the fetus. In the week number 4, you have to understand, in week number 4, which is important, the heart will be formed, but heart will not beat. In the week number 5, the heart will start beating. Okay, in the week number 5, the heart will start beating. So I will say you to go with the answer option B, because the question is the cardiac activity found in, not the formations. Am I audible to everyone? Am I audible, everyone? Am I audible, everyone? Am I audible, everyone? Just let me check. Just let me check. I think there is some. Okay, just hold on. Okay, just let me check whether I'm audible. Just hold on. I think I'm audible. Yeah, I think I'm audible. Okay, all right. Okay, so the fifth week is I should request you to go with the options fifth week. Okay, I should request you. Okay, so I should request you to go with the options. Fifth week is the correct answer. Okay, fifth week is the correct answer. Obviously, fifth week is the correct answer. And if you think about the 12th week, you have to remember the most of the organs for the why the 12th week is important. Most of the organs are being formed at 12th week. Okay, most of the organs are being formed at the 12th week. So most of the organs are being formed at the 12th week. Why the question 20th week is important? 20th week is the week in which the fetal start moving. The fetal movement is important. Okay, this fetal movement is very important in 20th week. And 20th week is also important because here you will find the hairs, but hair not in the body, hair on the scalp. Okay, hair on the scalp. So hair on the scalp is important. Hair on scalp. Okay, is important here. But for the 24th week, you will find hair on the body, small fine hair on the body, So all the organs are being formed in the most of the organs are being formed in the 12th week. That's why we prescribe the mother very cautiously in between the 12th week. Okay, in between the 12th week. Okay, so it's a very important in between 12th week we prescribe the mother cautiously because most of the organs are forming at that time. So we have to be very sincere because there might be a drug effect if we prescribe anything in between 12th week of the pregnancy. So the correct answer is 5. Next question, which of the following level is found increased in pregnancy? Which of the following level is found increased in pregnancy? Which of the following level is found increased in pregnancy? Who can tell me the answer correctly? Yeah. All of the following. Yeah, absolutely correct. Okay, progesterone. Okay. Okay, here the answer is not being omitted. Okay, already you are smart enough. So progesterone is already, already the progesterone, you have to understand the progesterone is already high enough here. Okay, you already know the progesterone is high enough here. And not only that, apart from the progesterone, you have to understand the testosterone T3 T4 should be also high to support the growth of the baby. Cortisol will be also high because it's a stress hormone, and pregnancy is itself a stress. So in the mother body, cortisol will be also high. So all of the following is the correct answer, which will be high during the pregnancy. Question number 19, which of the following is not related with blastula? Which of the following is not related with blastula? Which of the following is not related with blastula? So yeah, its implantation is related with the blastula. Blastomere is related with the blastula. Testudal reaction is related with the blastula. Germ layer, if I say, and organ development, if I say. So then you have to mention which of the following is not related with the blastula. See, germ layer and organ development, this is the part of gastrula, not the blastula. Okay, so the correct answer is this, because blastomere, it is present since morula, it is present in morula, and it is also present in blastula. If I say implantation, implantation will start even from the blastula, but not in like in the fallopian tube. In the uterus it will happen, and testicular reaction will start in the blastula, even in the blastula stage. Okay, but not the germ layer formation, because germ layer means ectoderm, endoderm, mesoderm, which will form in the gastrula stage. Next, and I think this would be though I told you, I promised you to solve 40 questions, but I think we should stop today here, and because next sessions we can conduct at any day. So which of the following hormone gives the signal of corpus luteum of pregnancy? Which of the following which of the following hormone gives the signal of corpus luteum of pregnancy? I have already mentioned the corpus luteum of pregnancy is a very important concept. Normally, if you consider the ovary, in the ovary, you know, that is called corpus luteum, and basically, you know, the corpus luteum, where what is actually present in the ovary should not persist in a non-pregnant lady. But if you have a signal of HCG, definitely it will persist, and that's why that corpus luteum is called corpus luteum of pregnancy. So HCG is the correct answer. Should I continue? Should I continue these sessions? If you say, if you are quite energetic right now, I will then definitely continue the sessions. But if you say, no sir, we are not energetic right now, then I will stop these sessions. So are you enjoying, and should I continue this session more? Okay, so people are saying, okay sir, continue the sessions. Okay, so definitely if you are saying, then I will continue the sessions. So the next question, number 21 on the screen right now. Okay, so definitely I will continue. I'll continue the session. So question number 21. Question number 21 is a very important question. Completions of the oogenesis possible after. This is a very important question. Oogenesis is actually the sequential development of the female gamete, because you know female gamete will start from the gonia cell, then from the female, that is called oogonia. From the oogonia you will have something called primary primary oocyte, primary oocyte, that is I'm writing like PO. From the primary oocyte you will have something called, is called secondary oocyte. You'll have secondary oocyte. Okay, from the secondary oocyte you will have the next one, which is very important, which is actually called ootid. Ootid, ootid like spermatid. Okay, and finally from the ootid you will have called ovum. Okay, or basically so finally we can say ootid, and at the end of the ootid it will form the next stage, that is called ovum. So I just want to tell you, in this completions of the oogenesis, in the completion of the oogenesis, there are different actually different stages of development, like primary spermatocyte, secondary spermatocyte, and ootid. I think there is a cell division, meiosis is required when you are converting primary spermatocyte into the primary oocyte into the secondary oocyte. But this conversion, which is actually known as meiosis, it consists of meiosis 1 and meiosis 2. My point of discussion is this is such a stage which requires a lot of factors. When you are completing the meiosis 1, basically at the time of puberty, your diplotin phase can only be completed, but still In the puberty, you are only completing the diplotin, I mean the meiosis 1. Still meiosis 2 is remaining. This can be only completed if you get the spermatozoa, if you get the centrosome of the spermatozoa inside the ovum. So it is only possible after the syngamy. So the complete meiosis, that is the meiosis 1 and meiosis 2, it is only possible after the syngamy. It is only possible after the syngamy. But here is another answer, entering APF, that is anaphase promoting factor, which is also the similar incidence. So when you are getting already the option D, I will request you to go with the option D. So correct answer is option D. In this question, D is better answer than A. In this question, D is better answer than A. In this question, D is better answer than A. A is the fact, D is the effect. A is the fact, D is the effect. If you have any confusions, please let me know. I will again explain. If you have any confusions, I will again explain. Please let me know. If you have any confusion, please let me know. I will explain again. Okay. Do you have any confusion? Do you have any confusion? Because this is a very conceptual questions. Again, I am repeating. When you are doing oogenesis for the females, I am saying when you are doing the oogenesis, you need oogonium, primary oocyte, secondary oocyte, oocyte formations, and finally, that is called ovum. So in this process, the primary to secondary conversion, you require meiosis. Meiosis, there are two parts, meiosis 1, meiosis 2. Now meiosis 1 will be completed, I mean it will be completed in presence of different hormonal influences at the puberty only. Because otherwise, if you don't reach the puberty, your meiosis will be stopped at diplotin. Okay, your meiosis will be stopped at diplotin in the childhood days. For a childhood girl, the formations of the oogenesis is stopped at the diplotin phase of meiosis. But when the child reaches puberty, it will cross its diplotin, but it will not cross its meiosis even at that time. Now when it will cross its meiosis 2, only after the entry of the sperm. So I mean after the formations of the zygote. So if I ask you, a lady is having 4 child, okay, lady is having 4 child, 1 abortion, how many time you can expect there is a complete cell divisions, that is the end-to-end oogenesis oogenesis is done, obviously including the abortion you have to consider, because at that time of abortion is actually the expulsion of the product before the delivery date, that is the abortion. So but it was definitely the zygote was formed. Okay, so we have to consider that one also. Question number 2, how many meiosis you require, how many meiosis cell division you required to form 300 polar bodies? So you have to answer when you are doing suppose this is the primary oocyte, and from the primary oocyte, if you are undergoing meiosis, in the meiosis 1 you will get, there are 2 cells, one is like this is the secondary oocyte you are getting, and at the same time you are getting another small polar body. The function of the polar body is yet to be discovered. And if you go with the meiosis 2, from this secondary oocyte you will again get another, this is the egg cell, that is the ovum, and you will get another polar body from here, and definitely from this previous polar body it will again undergo mitosis, and you will get another 2 polar bodies. So in totality you are getting 3 polar bodies at the end of the meiosis. So 300 polar body you require, so you require 100 cell divisions. I mean in a 1 meiosis you are getting 3 polar bodies, so 300 definitely it required. So for the 300 you require 100 polar bodies. So correct answer is A. Correct answer is A. Only one Ombika has answered correctly. Only Ombika has answered correctly. Only Ombika has answered this question correctly. Clear everyone? Clear everyone? Yes or no? Okay. The next question. the next question on the screen. If you have any confusion, you just request me, you just ask me to repeat. I will definitely repeat that question. Okay, the next question. Okay, so Shubhadeep has answered the previous answer wrong. Many people have answered the previous question which was wrong actually. So I'd request everyone to be sincere while you are answering. Okay, so cyclical changes of endometrium take place in the influence of all except. Okay, cyclical changes occurs in the influence of except. You tell me what is the cyclical changes. So cyclical changes occur, influence. Okay, all right. Okay, so can you please tell me that what would be the answer of this question? Who can tell me the answer of this question? Who can tell me the answer of this question? Who can tell me the answer of this question? Cyclical changes of endometrium take place in influence of everything but except. Listen, endometrium, when I'm talking about, estrogen helps in the cell divisions of the endometrium. If I say this is the line of the endometrium and this is the cell, if I draw, the cell division is controlled. If I am drawing the cell division, this is the cell, you know, this cell division will be controlled by estrogen. If I say about the progesterone will help in the mucus gland mucus synthesis. This is the mucus, you know, goblet cell. The progesterone helps in the mucus gland synthesis. Estrogen helps in cell divisions of the endometrium. Estrogen also helps in blood supply, formation of the proper blood supply in the endometrium. So proper blood system formation or proper blood supply or blood vessel formation, and estrogen also helps in, you know, cell division. This is two which is being performed by estrogen, but mucus synthesis is performed by progesterone. So definitely it is taking a part of your endometrium, endometrial proliferations. Now FSH and HCG, if I say HCG does not have any direct role on proliferations of endometrium. HCG will help your ovary to maintain the corpus luteum, and you know, from the corpus luteum, what are the three hormones? Beta, I have already explained. Can you tell me what are the three hormones from the corpus luteum? Who can tell me? I have already explained at the beginning of the class. What are the three important hormones which are being formed from the HCG? Who can tell me what are the three hormones? What are the three hormones? Can you tell me what are the three hormones being secreted from the HCG? I have already explained. First option, you have to mark the progesterone. If in the option you don't have progesterone, you have to mark estrogen, because estrogen is also secreted in a small amount. And if you don't have that one also, you have to say something called relaxin. You have to say something called relaxin. Clear? So this is something you have to remember. So obviously HCG is not directly helping, but if I say about the FSH, okay, if I say about the FSH, what does FSH do actually? Okay, FSH actually helps in, you know, FSH helps in the ovary. If FSH from the pituitary, it will help stimulate your ovary, and from the ovary, you know, there will be secretions of your estrogen. So now you might be very confused that what should I answer, go with either FSH or HCG, from which particular answer you should answer. Okay, people are answering, let me find. Yeah, okay, everyone is answering D, I know. So, and I think D is the best answer, because if I say FSH is best and HCG is less, then HCG will have a direct action. Though I agree that FSH is not having the direct action, but you know what happens if you have FSH on the endometrium, then estrogen works better. Okay, so I would request to go with the answer HCG. Okay, HCG is the best answer, because FSH is not the best answer for this question. So what I want to point out, when you are in the world of MCQ, you have to be very confident and you have to be selective. Okay, when you are dealing with two options which are very close to the answer, you have to pick one and you have to leave one. So which one to pick and which one to leave, you have to know nicely. So milk secretion is controlled by all. That's a nice question. In the discussions of another, I have also discussed, if this is the breast, there are a lot of glands which are actually called mammary glands, and this is the mammary gland. So here I am drawing the mammary glands. Okay, there are many mammary glands. I have only drawn one. So this is how the milk is synthesized from the blood. Obviously the mother is having something in the blood, and that blood is actually filtered, you can say, or whatever you say, and from the component of the blood, definitely milk is being synthesized inside the gland. There is no doubt in it. Okay, now the question, which of the hormones which helps in the milk secretions? Yes, it is dopamine which helps in milk secretion. You have to know this. Yes, suckling helps in milk secretion. Absolutely correct answer, because when the baby suck or the nipple, at that time the mother can feel that, and from the brain, in the brain, in the anterior pituitary, there is something called hormone prolactin. That prolactin comes and stimulate again the mammary gland to take the component from the blood and produce the milk for the next release. So obviously prolactin will be the another answer. If you say about the oxytocin, I just want to mention oxytocin has a role in milk, obviously, but not in the milk secretion. What does oxytocin do? Let me find people are already answering or not. I would request to answer this question. Yeah, you have answered correctly. D. Mouli Haldar, Ombika Das, Mihit Josh, Amrita Das, Shoromita, sorry, and you have answered it correctly. Sorry. Okay, so if I say about the oxytocin, what would happen? Oxytocin is a hormone which basically helps in the contractions of the mammary gland. Okay, so that's why it helps in the ejection of the milk, not the synthesis or secretion of the milk. Secretion means this is called the secretion. So when you are talking about the oxytocin, you have to be very particular, and you have to search for the word ejection. When you are finding the oxytocin, you have to be very particular, and you have to search the word ejection. Okay, all right. If you are finding the word ejection, then only it's possible that you are in the right way. Okay, so oxytocin helps in milk ejection, and at the same time, oxytocin also helps in the ejection of the fetus from the ovary, from the uterus. Okay, so it helps in only the ejection, fetus ejection, and the milk ejection, because it always helps in contraction. Oxytocin is the correct answer. Question number 25. This is a question based on topic parturition. Parturition is the delivery. What is the parturition? Parturition is the delivery. Delivery of the baby is called parturition. Delivery of the baby is called parturations. So if this is the uterus, I consider, if this is the uterus, I consider, and if I consider this is the baby, what happens next if this is the baby. So parturition is somehow the myometrium will contract. Again, I am repeating, I'm not right now mentioning the endometrium. Here I am mentioning the myometrium, that is a muscle wall of the uterus, and that will contract to eject the baby. And again, I'm talking about the word, I am using the word eject. So obviously there will be something called oxytocin which will help. But the question is that when you are talking about the delivery phase, there are three important phases. One is called dilation phase, and it's called the expulsion phase, and it's called afterbirth phase. What is the dilation phase? At the dilation phase, the uterus start contracting, and it contracts almost over 10 to 12 hours. And at the same time, there is a cover, the amniotic cavity which covers the baby. So at that point of time, this amniotic covers actually ruptures, and the fluid will come out through the uterus, from the cervix and the vagina, and the mother will find the fluid is coming, and this is the sign that the baby is in the way of delivery, and the mother should run to the hospital in this time. So phase of dilation, it actually gives time to the mother, and it actually, this contractions of the uterus and this fluid coming, it would happen for the 10 to 12 hours. So this is the longest phase. Expulsion phase, the time duration in which the baby will be delivered. So once this dilation phase is done, okay, and in the dilation phase also the cervix will dilate, because cervix has to be dilated. And what is the birth canal? Birth canal is cervix plus vagina. Cervix plus vagina, this is the MCQ question. Cervix plus vagina togetherly, it's called birth canal. Cervix plus vagina Togetherly it is called birth canal. Okay, togetherly it is called birth canal. Okay, you have to remember this information. So birth canal diameter birth canal will be dilated so that baby can pass. Uterus will be contracting, and the amniotic membrane should be ruptured. This is something which happens in the phase of dilation. That's why it takes 10 to 12 hours. Next phase is the baby delivery phase, or that is simply called expulsion phase. Baby will be expelled out. It takes hardly 30 minutes to the 1 hour. But once the baby is delivered, the baby was attached to a particular structure which is called placenta. If I am drawing this placenta, and this is the umbilical cord, and this is the baby. If I am drawing, once you deliver the baby, still there is a placenta is remaining inside, so you have to also deliver the placenta as well. And to deliver the placenta, again you have to apply more oxytocin, because that will also contract the placenta to deliver out. And that's why we are contradeciduate. We, the human beings, are contradeciduate, because for other animals the placenta may even remain in the uterus and that will be degenerated slowly. But for human, you have to ensure that after the delivery of the baby, placenta is delivered within 15 minutes. Okay, you have to deliver the placenta within 15 to 30 minutes, actually I should say. Okay, so this is called afterbirth phase. So this is also in like around 1 hour. Expulsion phase even may happen within 15 minutes. Okay, this is 15 minutes. So definitely the dilation phase is longest. But why not the last option, parturition? Because here we have already mentioned longest phase of delivery. Parturition is nothing but the another meaning of delivery. So parturition and delivery actually same thing. Parturition and delivery actually same thing. Okay, both are same. Whatever we are saying parturition, that is actually delivery. So but in this question is asking longest phase of parturition or longest phase of delivery, so we have to go with the answer phase of dilation. Okay, so see, this question is asking, checking many concepts of you. Okay, this question is checking many concepts of you. This question is checking many concepts of you. Okay, this question is checking many concepts of you, and you have to be very confident. This question is even checking that whether you know that delivery is called parturition or not. The next question, first sign of live fetus. First sign of live fetus. First sign of live fetus appears is heart sound, movement. I have already explained movement. You will have in movement at 20th week. Digit formation, okay, I forget to mention lastly, sorry, it should be in the 8th week. 8th week is the digit formation. Heart formation is the 4th week. Okay, heart formation is the 4th week. Movements, 20th week. Okay, heart sound is the 5th week. But the question is asking first sign of live fetus. Now you tell me. Okay, let me find how many of you are answering correctly. Let me find how many of you are answering correctly. Okay, everyone, I would request everyone to answer these questions. I would request everyone, because you should answer this question. You should understand. I have already explained these informations. How should you answer? Okay, people are answering D, heart formation. Heart formation. Why you are making the mistake again and again? Okay, can you see the heart is formed? But I mean, the baby is at like in the mother's womb, and whether the heart. Do you think the presence of the heart would exclude the baby is dead? Do you think the presence of the heart would exclude the baby is dead? No. Okay, if you are unable to listen the sound of the heart, then you can say yes, the baby is dead. So it's the heart sound which is more useful as a criteria of your live fetus. Okay, as a criteria of the live fetus. So this is something you have to know. So the correct answer is 26A. Heart sound is the first sign of the live fetus. Okay, clear everyone? Clear everyone? Everyone, please let me know. Clear everyone? Let me know. When concepts are clear or not, This concept is clear or not? Please let me know whether the concepts you have got the concept or not. Please let me know. Am I audible to everyone? All right, I am not receiving actually. So yes, yes, you are saying yes. Okay, all right. Okay, okay, all right, all right. So the next question, HCG. HCG related with Gravidex test except it is beta HCG, absolutely correct answer, because there is something called alpha HCG which is not in use to detect the Gravidex. What is a Gravidex test? Gravid means pregnant. Gravidex test means pregnancy test. Okay. So this pregnancy test needs the beta HCG, absolutely correct, not the alpha HCG. Alpha HCG will not help you in detail for the, for the pregnancy confirmation. Rather, beta HCG will help you more. And if I say the syncytial trophoblast, yes, HCG is secreted from the syncytial trophoblast. Day 7 onward, yes, it's also correct, because on the day 7 you will have implantations, and so people are answering it as answer D. Shoheli Dhara answered it D. Amrita Das answered is D. Yes, correct, because detrimental and harmful to corpus luteum, absolutely not, rather it is useful in corpus luteum, so the correct answer is option D. Question number 28. Which of the following is not function of Jonah pellucida? Jonah pellucida. This is a bit wrong in the question. Okay, this is the spelling is wrong. Jonah pellucida. So Jonah pellucida does everything except it does cortical reaction. I have already explained what is the cortical reaction, how with the help of cortical reaction the it creates a barrier it creates a barrier because they don't want the multiple sperm entering in the ovum, so cortical reaction is important. Jonah pellucida also does something called first block mechanism. First block mechanism means whenever in the Jonah pellucida a spermatozoa touches, there will be change in the potential. The entire membrane of the Jonah pellucida will be plus. Entire membrane of the Jonah pellucida will be plus. Plus means that is called depolarized. So when it is depolarized, the next sperm cannot get an entry. So this is also helped by Jonah pellucida. Prevent the ectopic, I have already mentioned. Jonah pellucida is a layer. Jonah pellucida is a layer which prevents the implantations in the ampulla. Okay, because Jonah pellucida is there. If you find you don't have Jonah pellucida in the ampulla, your fetus, your embryo may get implanted, and that is very dangerous. But as thanks to God that you have Jonah pellucida in the ampulla, so that it will not implant in the ampulla and it will migrate to the uterine endometrium, where it will finally implant with the help of syncytial trophoblast and trophoblast layer. Clear, everyone? Clear, everyone? Yeah, correct answer is helps in implantation. Absolutely wrong. That is, it prevents implantation. Okay, prevent ectopic is the correct answer. Helps in not a correct function. It helps in implantation. No, it doesn't help in implantation. It prevents the implantation. Okay, Jonah pellucida, because it's a cover. It's a cover. This cover has to be removed, because this is the layer, primary membrane. You don't want only the primary membrane, because Jonah pellucida is the secondary membrane. You don't want Jonah pellucida. You want primary membrane, which will form this syncytial trophoblast to get implanted. Next question. Most of the organs are formed within fetus in first trimester, second trimester, third trimester. This is a very important question. Most of the organs after second trimester, third trimester, or none of this. Let me find people are answering E, none of this. Okay, I think not. So what is the correct answer? Let me know. Okay, what is the correct answer? Okay, what is the correct answer? Okay. What is the correct answer? Yeah, no. Correct answer, no. Correct answer, I have explained first trimester means 12th week. Second trimester means almost more than 25, 26 weeks, 28 sometimes people say. Third trimester remaining. So definitely most of the organs, this is the NCERT information, you have to remember. Most of the organs are formed in the first trimester. Okay, most of the organs are formed in the first trimester. 29 should be A. 29 should be A. 29 should be A. Yes, 12th week is the correct answer. People are telling any answer. Someone is telling B, someone is telling C, but no one is telling A. But A is the correct answer. I thought everyone would answer this question correctly, but no one has answered it correctly. So yeah, only one right now I'm finding. Ankita Ghoshal has only answered this question correctly. It is 12th week. Okay, it is 12th week. Most of the organs in the fetus is formed in the first trimester. Okay, that's why again I have repeated now. When you are giving any drug to the fetus, you have to be very sincere. I mean, when you are giving a drug to the mother within the 12th week, that is the first trimester, you have to be very sincere. I am giving the drug to the mother that can affect the baby, because in this 12th week the organs are being formed, and that's why we have found, like, have you ever heard about thalidomide drug? There is a drug thalidomide which we used to prescribe to prevent the vomiting tendency of the mother, and there are many uses as well. But if you give thalidomide to the mother within 12th week, the baby will not have proper limb. Okay, that rather the baby will have like a shill like limb, like a shill like limb. This is called phocomelia disease. So why that happened in the baby? Because the digit is formed, the digits and limbs are being formed. I have mentioned in the 8th week. The digits and limbs are being formed. So you are within 12th week actually. So you can see that if you give the drug within 12th week, definitely you are in the 8th week, and you will damage the development of the limb and hand with thalidomide drug. So the take home message is, the first direct NCERT information, that 12th week is very important, which is a part of first trimester. And in the first trimester, if you give drug, you have to be very cautious, because most of the organs will be formed within this time. Next question number 30. Which layer of the blastocyst helps in implantations? Which layer of the blastocyst help in implantation? If you see the blastocyst, there are two types of cells. One is actually like finger like cells, which is called syncytotrophoblast or chorionic villi. Okay, villi like structure from the fetal membrane, which will be in contact with the endometrium, and thereby it will help in the implantation process, and they don't have their proper cell margin, so they are called syncytotrophoblast. So in this cell you will find multiple nucleus is visible, but no proper cell boundary is visible. That's why these are called syncytotrophoblast. Syns means joined. Cells are joined. It is looking like cells are joined because we cannot find the boundary of the cell, that is a cell membrane, but we can see only the nucleus. That's why I call syncytotrophoblast. But if you see other cells where you can clearly see the margin of the cells, and that's why these are called cytotrophoblast. These are called cytotrophoblast, where the margin is clearly visible. Okay, these are called cytotrophoblast. This is the margins are clearly visible. Now the question is asking, which one is helping in the implantation? Obviously syncytotrophoblast. Okay, but cytotrophoblast, what is the function of the cytotrophoblast? It will help you in many ways. It will give you the cover. Okay, but the nutrition collection and the implantation is held by syncytotrophoblast. What is inner cell mass? Inner cell mass is a story inside this embryonic membrane. If you have ever seen, there is a small cluster of cell from where the entire fetus will be formed, which is present in the fetal membrane, which is called inner cell mass. Remaining is the blank space, which is actually called blastocele. Okay, remaining is the blank space, which is called actually blastocele. So the correct answer is syncytotrophoblast. So we are ending our session here. We are drawing conclusions here. and hope you have enjoyed these sessions, and we will come up with the next physiology sessions on the next day. And if you have any query, you can ask me still. Okay, yeah, people have answered it correctly. Moli Haldar, Rakiaj Molla, Shoheli Dhara, Ongita De, Omrita Dash, Ombika Dash, and Nisha was answering it A. So I think, hope you have enjoyed this session. So if you have any confusions, let me know. I will answer, otherwise I'll leave this session. Thank you so much for this cooperation, because middle of the discussions we had some glitches. With the help of you guys, I solved it and I continued the discussions. And if you have any confusions, feel free to ask me. You can also mail us in official mail. You can also send the doubt here. And so if you have, do you have any confusions? Do you have any questions on the questions we have discussed? We have only picked out those questions which are repeatedly asked in the NEET exam, where the concepts are being hit for multiple times in the NEET exams. And definitely these are potential MCQ from any upcoming NEET exams, obviously. Like HCG, SYNC, trophoblast. These are like the words of answer. These are the words of answer. Okay, so bye bye. Okay, so thank you for the amazing session. Thank you so much, and hope you have enjoyed the audio today. I have specially arranged the studio for this audio sessions, and hope you have arranged. Yeah. So and the next day, I promise you definitely this the screen right now, the sharing problem, screen sharing problem which we had in these sessions at the middle, that will be obviously solved. And so yeah, so thank you so much for appreciations and for your patience and for your cooperation, obviously I should mention. So bye bye, take care, lots of love, lots of blessings.